Our feet are often taken for granted, but they will only stand for so much before they start to hurt. This week we examine tingly, achy feet, from gout to plantar fasciitis. The doctors are on call tonight.
These boots are made for walking, and that's just what they'll do.
Funding for On Call is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
Welcome to On Call Television. Today's topic has all to do with the feet. The definition of 1 foot is more than 12 inches. Each single normal human foot contains 26 bones, 33 joints, and greater than 100 tendons and ligaments, as well as uncountable nerves, vessels, and connective tissue cells. With so many working parts, with the big job of supporting and balancing the rest of the body, with all the pressure that concentrates upon those 2 narrow appendages, and with all the abuse that the feet take, it is surprising that more problems don't occur with the feet. That being said, there are many examples of foot and ankle problems. These run from twisted ankles, bunions, and hammer toes, to warts, corns, and calluses, to ingrown bacterial and fungal infected toenails, to diabetic neuropathy, Morton's neuromas, and plantar fasciitis. Here to help us discuss these topics and to answer your questions live are Doctors Judith Peterson and Jonathan Blake. Dr. Peterson is a graduate of Harvard University and the Cornell Weill School of Medicine. She did her physiatry residency training at the Rehabilitation Institute of Chicago and Thomas Jefferson University in Philadelphia. Presently, she's practicing at the Sodak Rehabilitation Center in Sioux Falls. And I should add that Judith is consultant to the Pennsylvania Ballet and the Sioux Falls Roller Dolls, advising both groups in coping with the challenges of either dancing on the ends of one's toes or shoving hard while balancing on roller skates. Both are quite formidable challenges. Dr. Jonathan Blake is a graduate of the University of Central Missouri in Warrensburg, Missouri, and of Kansas City University of Medicine Biosciences. He did his orthopedics residency training there also, and his practice involves the practice of general orthopedics. Presently, he is practicing at the VA hospital in Sioux Falls. I've shared patients with this talented surgeon and appreciate his style, caring way, and especially good results. Thank you both for joining us today as we explore the intricacies of the foot, all sorts of foot pathology, and attempt to answer our audience's questions.
Well, thanks for having me, Rick.
You bet.
Yeah.
Let's start with you, Judith. Actually, it was your idea to do this show about feet. Now, what was it that triggered that particular question?
Because so many people have problems with their feet and don't really know what to do about it. They're not even sure if it's a problem, but they have difficulty walking. But you know, we tend to not necessarily deal with it as quickly as we might. We tend not to do the simple things that can really help. And so I thought this was a common problem that I suspect a lot of your viewers have issues and questions about. And I thought maybe this would be something that would be really great for us all to talk about today.
Right. I think people ignore their problem down there.
I think they do. And I think because a lot of times it tends to be one of these things that sneaks up on one.
Yeah.
And so, you know, obviously if you sprain your ankle, you know you're in trouble. But a lot of times this is kind of this slow issue and people just have a little bit of problems or discomfort, but it seems to be growing and growing and they're not quite sure what to do. So I thought this was a great thing for us all to talk about, since I know every single one of us here deals with this and questions about this on a daily basis.
A lot. Jonathan, you know, as an orthopedic surgeon, and you do all sorts of things. You do shoulders and knees and hips and feet. What do you see as an orthopedic surgeon, the problems of a foot? What's your perspective?
Well, I would say I agree with Dr. Peterson. People blow things off, for lack of a better way to put it, but in lay terms, they just push things aside, and then there are certain times where we have to do drastic things as orthopedic surgeons. And I can't tell you the amount of, for example, diabetic feet that I've seen that have gone on to need an amputation where if they just had some education and some help on their foot care, you could prevent that. And I think the other thing that's interesting about feet is if you look at the specialties in medicine, look at podiatry. I mean, we don't have you know, a subset of helpers, if you will, for elbows and for hands. We have orthopedic hand specialists. We have orthopedic foot and ankle specialists. But podiatry is huge in the United States.
Right.
Why? Because of what Dr. Peterson said. People don't want to see me. That's to have surgery. You know, they need to prevention is better than cure for what I provide as a cure as a surgeon.
You know, we have one question already. Let me just read this one. A 50-year-old female. My toes and fingers turn dead white when the temperature gets colder. I have some numbness and mild discomfort. There's a distinct line between pink and white skin. I was told it was not Raynaud's. Is there anything I can do to prevent this? And in general, it's difficult to keep my hands and feet warm in the wintertime.
Well, you know, this is an important question because, you know, the weather is turning colder. So
right. And these people have more problems as the weather turns cold.
Right. The first thing I would say is that if this is somebody who's using tobacco and cigarettes, you know, this is not a good thing. And you know, it's never a good thing. And it's all the more reason to discontinue because certain medications that we take can make our hands and toes colder and more susceptible to low blood flow. I think that, you know, so that needs to be evaluated. And then also certain underlying medical conditions can make our hands and feet more likely to turn colder or bluer. And there's specific medications and treatment that can be done for that. And so these are helpful things to think about. You know, as obvious as this is going to sound, one of the helpful things in not having your hands and feet turn cold is to keep them warm.
Yeah,
and,
there it is.
And you know, when I say that, what I'm thinking about is, you know, if you know you're going to be going into a colder zone, bring gloves. If you know you're going to be walking in a colder area, thicker soled shoes, thicker socks, layers tend to really matter.
And there is that whole issue of keeping your feet warm, but then if you get them too warm, then they sweat, and then you've got wet,
right.
And then wet gets colder. So there is a real dilemma on how to handle foot warmth issues. John?
Yeah, it can get expensive. My first thought on that was you know, buying good socks. But in overall, the picture, what I would tell this lady is move to Phoenix in the winter. Yeah. Now, is that practical? No. And so Dr. Peterson's so eloquent and wise on these things that there's not a whole lot to add. But you do get into some difficulty, as you point out, with the moisture. To buy these smart wool socks that I love those socks. But geez, they're expensive. When you're talking $15, you know, a pair, and you know, and then you can get into a whole different subject of the economy. But to afford those, but you may need to, because we all have our health issues, and this particular lady needs to possibly do that for
moisture wicking.
Yeah.
Yes.
Also, moisture wicking with your issue that you brought up.
Right. Cotton is wrong because cotton does not wick it, and so the new plastic stuff, it wicks it away. I do think too, if you you just got to know, it's sort of like taking care of yourself in the winter. You take off layers when you're hot so you don't sweat. Oh, I'm getting cold, so that you add layers. It's not so easy to do with the feet, but you know, you have to prepare yourself with the right footwear. I think she's got Raynaud's. I think those layers, or she's got Berger's disease. That's what it's called. Let's talk about Berger's disease.
I actually saw a fellow with that. It was in his hands last year, and it hadn't manifested itself in his feet. It's a vasculitis, and that's why you were kind of alluding to some of the things you were talking about for a medical workup. But he was actually starting to get ulcerations and basically necrosis, or where the skin is dying. And he was a young guy. He was between 35 and 40, and he could hardly believe that it was smoking. That's the first thing you said. I would suggest if you smoke to stop. And he was a great guy. And I'm like, I'm really not picking on you. I know that you go to the doctor, he's going to say quit smoking. I've heard that so many times. It's like, listen, in reality, you're giving the doctor business to smoke, but this could cost you your fingers, amputation. And I showed him pictures and your toes. Got on, and now get on the internet right there in the office. Say, listen, here it is, and he's like, oh my goodness.
Berger, apostrophe S, and or Raynaud's, or you know, the things that are like Raynaud's, which we should talk about in a minute. Plantar fasciitis is a painful condition that can present in a wide variety of patients for a variety of reasons. We visited with Dr. Travis Venner of Core Orthopedics Avera Medical Group to find out more.
Plantar fascia is a ligament on the bottom of the foot, attaches to the heel bone, goes up to the front of your foot. What it does really is supports the arch so the arch doesn't collapse. Plantar fasciitis, typically patients will say they have quite a bit of heel pain, mostly in the morning when they first get out of bed. First 15-20 steps, typically it hurts quite a bit. As you get moving, feels a little bit better. As the day goes on, it's pretty painful. If you sit down at lunchtime, sit down at dinner time, feels good to get off your feet, but you don't want to stand back up again. Why it really occurs? It could be biomechanical, could be shoes, could be increased activity. Some people will go do a run and be painful. Reason for it, don't really know. Diagnosis of plantar fasciitis, it's very easy to diagnose. Typically patients will have pain right on the medial portion or the inside portion of the heel. You'll palpate right there, and a lot of patients will have significant pain. It's almost all clinical. Patients get out of bed, hurts 15-20 steps, goes away for a little bit, more you're on your feet. It's really a clinical diagnosis. I've seen it all the way from college athletes all the way to nursing home patients that are just walking around. I've had it before. I got it after the Des Moines Marathon. Very painful. What I typically do when I see someone the first time, first three things: steroid injection. Steroid breaks up the inflammation along the plantar fascia. Stretching exercises, need to stretch the calf muscles out. They think part of it has to do with the calf muscles getting tight on you. And the other thing I try is an anti-inflammatory just for a 2-week period of time. Typically we try this first, give it a month to 2 months. If it doesn't work, you can go on to a physical therapy modality called iontophoresis. What they do is they put a patch on the heel, and it helps to push a steroid in through the skin into the plantar fascia. You can also try orthotics. Orthotics can be beneficial. The only problem with orthotics is you need to wear them every single day. Shoes are somewhat limited. You can also try night splints or a Strasbourg sock. What that is, it's an apparatus that you put on at nighttime, and it helps to hold your foot up and keep your calf muscles stretched out while you're sleeping. I've had some patients come in, they get it on the right side, 2-3 years later, next thing you know they have it on the left side. A lot of patients though, they get it once, doesn't come back. When we do get an x-ray, sometimes patients will have a spur on the bottom of their heel. 20, 30 years ago, they used to go in surgically, excise that spur, thinking that was the cause. Current basis is we do not go in and surgically resect it. For me, I had plantar fasciitis after a marathon I ran. I got an x-ray just to make sure I didn't have a stress fracture afterwards. I do not have a spur. There are many people that we get x-rays on that have spurs at their heel that do not have plantar fasciitis. So I tell a lot of patients, forget about the spur. The spur is not what causes your pain. Flip-flops are the worst shoes out there. They give no arch support. When you swing through on the gait phase, you have to contract your toes in order to keep the shoe on. Puts the plantar fascia at stretch, just when you're going through the swing phase, when you hit the heel, it pulls the plantar fascia even more. If I was going to give one, flip-flops.
That's great. And a comment about tennis shoes in a minute. But I want to say that we'd appreciate your calls. I mean, this is your show, 888-376-6225. That is 888-376-6225. Give us your call. Give us your call. And by the way, we do have a number of questions. But I wanted to make a comment. Flip-flops are maybe the worst. They've done a study where they looked at tennis shoes, regular shoes, barefoot, and what is the basic best shoe for a person who is older and protects them from falling? And the answer is the tennis shoe.
Right.
Your basic tennis shoe apparently, and the worst is barefoot.
And why is that?
I don't
the
know.
tennis shoe works because it fits.
It fits.
It fits. You know, you put on a tennis shoe and you adjust it so that it's not wandering around all over the floor separately from you.
Yeah.
And so therefore you have a shoe on your foot.
It conforms to your,
right,
your shape.
that actually provides shock absorption for you.
Yes.
So.
And it kind of sticks a little bit, enough, and there you
And
go.
it has traction, right?
Yeah. John?
Room for your feet too in those.
Right,
You know,
exactly.
a lot of shoes.
All right, here is the question from Mitchell. The question is, arthritis in feet causes pain and wonders what to do about it. John.
Well, that's difficult. Again, prevention's better than cure, and a lot of times there's two reasons why I think humans in general develop things. One's genetic, so you can't do anything about it, and two is what you're doing to yourself. So we've talked about one thing, smoking, but a lot of arthritis in the feet can develop from previous injury, post-traumatic, repetitive injury, and so proper shoe wear and your habits of what you're doing can prevent. And you have to identify those, and sometimes it takes the help of going to see a provider and a professional in that area to discuss what exactly am I doing to cause the problem. I'm not a lover of pills, so maybe Dr. Peterson could talk a little bit about medication for it or whatever you felt was best for this topic, but I don't like to see somebody and just say, well, take arthritis medicine, because so many of the medicines we prescribe have their downside.
Right. I totally agree.
Yeah.
Well, I think it's a really important question, and if somebody has arthritis in their feet, again, it's going to sound obvious, but the less stress you put on an arthritic joint, it's helpful, and so therefore, weight loss, weight control tends to be an issue. But one thing we don't talk about enough is if we have a joint that is having problems, it can be often very helpful to strengthen the muscles around the joint. And we don't really talk a lot about foot strengthening exercises, but those exercises exist.
So,
and they help with shock absorption.
Quick example.
Well, one simple example is the towel that goes down on the floor, and you pull the towel toward you with your toes. That is
You're
not.
You're going to give me business doing
that's
that.
Right.
You're breaking the foot.
That's
I
right.
think what she's talking about is you
right.
kind of
the doming
exercise. You do this
and then
you milk
push it away.
Yeah.
Oh.
Yours, I agree with him. It was a little frightening what just
Yeah.
happened there.
It was a little bit. It surprised me. It was a little more flexible than I thought it was going to be. Yeah.
But and then the other thing, when people have a lot of arthritis, arthritis causes pain and stiffness. Stiffness causes tightness. And so a lot of our patients who have a lot of foot arthritis, unfortunately, also have a lot of Achilles tendon tightness. And so sometimes a stretching program for that can really help. Now, I agree with you about the medicine that just gets, unfortunately, overdone, but foot whirlpools can be very helpful. Foot whirlpools accelerate blood flow to joints and can be quite helpful in terms of symptom control. And another thing that's helpful, if there is no medical reason why you shouldn't do it, is an ancient rehab technique, which is contrast baths, where you put the foot into warm water, cold water, warm water, cold water, warm water, because basically then you accelerate blood flow to the joints, and that can really be quite helpful with arthritis pain control.
And of course, people who have rheumatoid arthritis or psoriatic arthritis or any kind of weird arthritis may have really bad inflammatory process in the feet, and that could be part of it.
Yeah.
But the final thing I would like to say is I think that people who have general osteoarthritis sometimes do better when they're walking and exercising. And so if you become a couch potato, that may be the problem, and you need to be moving. if you don't have psoriatic arthritis or rheumatoid arthritis or severe problems.
And even if you have problems walking, you know, that doesn't mean that you can't maybe use an exercise bike for your exercise, or an elliptical that tends to have less joint pounding.
Right.
So you should be talking to your doctor about what exercise can be adapted to your specific situation.
Right, John?
Yeah, I couldn't agree more. My addition to what you had just kind of alluded to is some of these systemic things that are genetic, rheumatoid, lupus, that you can't avoid. I do think, though, personally, exercise is good for those folks, but structured by somebody who can give you guidance. And there is a lot of studies that point to that these folks that have rheumatoid, which is a disease process versus developmental osteoarthritis is wear and tear, they should stay active, whether it's pool therapy or you're talking about there's some exercise equipment. Those patients, their pain scores will be much improved if they maintain some activity level, even though they do present with some pretty horrific foot and wrist problems with the rheumatoid folks.
Right, as long as that hot inflammation is turned down.
Yes.
I do know that you've got this osteoarthritis. You get these they took a huge group and they've split them in two groups, and they had the one group with bone-on-bone knees, right? It's knees, and they forced them to exercise. The others watched the first group exercise, and who had less pain, who did better, who was stronger, who complained, who functioned better, it was the exercisers. Yeah. From Brandon, vasculitis, kidneys, numb feet, going into toes, no meds working. Vasculitis. Well, that's one of those collagen vascular or a vascular disease. It's an inflammatory process. It involves the kidney, so there's something going on that's destroying kidneys. So there's a big-time disease going on, and this person has numb feet. What can I do when meds don't help?
You know, I wonder if this is somebody who might want to talk to their physician about maybe an electrical stimulation unit, like a TENS unit, might provide some relief. It gives you a way to go around without necessarily affecting renal function. And when people say medications don't work, for nerve pain, one has to be pretty patient and do pretty thorough trials of medication. And so medications that we don't classically think of for pain tend to be what's helpful. And by that I mean that the medicines that we usually use to control seizure disorders tend to be helpful. And this also may be something worth talking to the doctor about. And frankly, sometimes there are medications that aren't originally designed for that use, but they have been found to be quite helpful.
Right.
But also to involve other things, such as the quote-unquote modalities that we use in physical therapy, might be a productive discussion.
Separate from pills.
Right.
And of course, you know that the non-steroidal anti-inflammatories, the Advils and the Aleve, and even the Tylenols can be hard on those kidneys.
Right.
So we want to be very careful.
Yeah,
John.
without a doubt. I agree that the underlying disease process that's going on here needs to be halted. And then there could be a chronic battle with the foot manifestations or hand manifestations, and then you have to look for alternative ways. I like that idea because all medicines, again, come with a downside, and certainly with kidney disorders, you're in trouble.
Boy, but your point of halting the immunological process that's going on, that has to be aggressively treated by the rheumatologist or the nephrologist or whoever's. Here's a good one. What is good foot sores product? What is a good foot sores product? Foot sores. Let's talk about foot sores. Ulcers on the foot. The big problem in ulcers on the foot are often in diabetic.
Right.
Yeah.
Is there a product there? The problem that you're being hit with is you got to control that diabetes. Many of these people have neuropathies, which means they don't have feeling in their feet, and many of these diabetics lose blood flow. So now you don't feel your feet, and you don't know that you're walking on a pebble in your shoe, and then you don't have the blood supply to protect it.
Right.
So foot sores with a diabetic in particular are
Well, I can tell you about if you're talking about diabetics, but any foot sore, because even if you're not diabetics, there's some pretty nasty bacteria out there these days. And I'll tell you, there is not one. You go to a conference this year, next year, there's going to be at least 20, 30 booths on use our product. So that is a very loaded question. Prevention is better than cure, and don't get the sore, especially if you're diabetic. I mean, diabetic foot care, you got to have a mirror. If you don't have anybody at home, you got to be checking your feet almost daily. You know?
I would say that there, particularly for diabetics, bring this, my product here. So my wife saw this and bought this, and she says, use this for the foot show. But the point I'm making is that all of us should spend more time caring for our feet. I mean, I think people commonly will take their shower. It hurts to stretch to get down to their feet. They won't clean between their toes. They won't clean around the toenails. They won't take care of their calluses. And here's one device that you can put on the bottom of the shower, and you can clean between the toes and scrub on the bottom and even pumice stone the heel calluses. But I think that's the point, that we need to protect our feet. And I think the first thing is that you wash them gently and carefully every time you shower or bathe, and then when you're done, you cream them up good. And I like Vanny cream.
And I agree with Jonathan also. I mean, you have to be checking those feet, because most big sores started as small sores,
right.
And so it's a lot easier to treat early. And also, the one thing I would add is, I would take a good hard look at my shoes too. And if you're finding that you have specific areas within your shoe that are consistently giving you pressure, particularly if you are diabetic, you need to really think about that and get pressure relief off that area, because it won't be a terrific outcome otherwise.
Pointed cowboy boots and ladies' shoes with points, and any comments, Jonathan?
Well, it's going to increase our business, surgical business for so I don't want to talk against, but I'm teasing it. We're plenty busy, and prevention, again, is better than cure. Those shoes are really not good. And that's a difficult sell, just like, we're talking about the guy with his fingers and the smoking, he couldn't, and it's like, I'm being honest, and it's the same with the shoes. I'm not, I still love you and want you as my patient. I'm not trying to offend you as my patient, but I'm going to say, listen, young lady, hopefully it's a lady, but with high heels, but you never know these days. And but those aren't good for you.
The size, the shape of the shoe is so important.
You're putting your foot in something that's not really meant for the foot, and they look great, but
we got questions, so we probably need to take them, but let's. So we've got 2 more minutes to go. We've got one from Sioux Falls. Have a growth on your right ankle bone on the outside, hurts toward evening, causes a watery sac, soft and mushy. What is this, and what can they do about it? So it's an ulcer, probably a blister, on the outer side of the ankle. Judith.
Well, it's hard to know what that is, because it's hard to know how old this person is, and that probably needs to go into a doctor to get looked at, because you can't assume that's a bursitis or that probably needs to get taken a look at.
I think the most common cause for ulcers on the ankles and in the lower leg is venous insufficiency, vein problems. And you just have got to get the edema out, the swelling out. Right. And there are several ways to do it. The most common is to wear support hose. Right. And it's got to be 18 to 22 pound or better, not the white Job stocking, or not Job's, what is the ones that we all get in? Ted. Yeah. 2 week. Jobst, good. Yeah. We want to go 18 to 22 pounds or more. And generally, below the knee is enough. So I would say, look at the edema. If you've got swelling in your ankles, there's the problem. Get rid of the edema. And while you're taking care of it, I generally say cleanse it twice a day, put a little Vaseline on the ulcer or the blister, put a dressing on it with a little paper, a little cotton gauze and a little paper tape, and then put that hose on. Other thoughts?
Well, one more thought about the chronic mushiness at the outside of the ankle, which is a lot of times people who have chronic, I have sprained my ankle, doctor, 12 times, we have chronic problems at the outside of the ankle that need to be helped so that person walks on a more stable ankle. So it's not just the mushiness that needs to be addressed for some of our patients, it's
Yes.
the ankle instability.
Ankle instability.
Although the mushiness is annoying as well.
Yeah, we don't like the mushiness.
Mushiness
No.
is not good. But
Okay. A life of activity coupled with a genetic link can bring a variety of foot ailments. While there may not be a cure, there are some treatments and lifestyle changes that may help.
In about 1980, when about the time I moved to Brookings in 80 and 81, in that era, you start out with gout, usually with gout, and I had, you know, I was jogging a lot, and I'd come home, and my ankles and my toes would be so sore, and pretty soon my big toe on the right side became almost solidified. There's hardly any movement in it at all now. It's all filled with calcified material in the joints. So that was a start. And then my circulation has always been a little bit dull, and so as I would go to the doctors, finally it was identified that, you know, I had neuropathy, and so that was in the late 80s probably. You have that tingling feeling from the knees down. Due to the fluid in my feet, I wear stretch hose or stockings up to my knees, and that seems to help a little bit. I elevate my feet at night about 16 inches. I've got a bed, you know, like a hospital bed or a bed that'll elevate your feet. With the gout and the lack of circulation and the difficulty for you to return lymph back up the legs, start to get a lot of swelling in the toes and feet. And so it's just gradual. Not a lot you can, I've not found anybody that's given me any encouragement that it's ever going to get better. Matter of fact, the doctor said, well, you know, you better stay as active as possible because someday that you could be in a wheelchair. That's why we've got an automatic door over there, and there's no steps anywhere around the house for the first floor and coming in from outside, so that if that would happen, you know, I'd still be mobile. I exercise 3 times a week at the gym, walk a couple of miles, ride a bicycle, do some work with my leg weights for the knees because I just had a knee replacement. I'd say in the last 5 years, it has not really gone, you know, where it's gotten a lot worse. Matter of fact, I think it's slowed down a bit, so that's good. You know, I've got a little problem with my balance. I had a situation a few years ago, the first time it happened to me. I was at the top of the stadium one afternoon carrying a sleeping bag, and it was a little windy and icy. And I walked over to the aisle, and there was nobody near me, and I turned and looked down those steps, and I could not take the first step. I just wouldn't do it. And somebody came over and said, just put your hand on my shoulder, Frank, we'll get you down. And after a few steps, then it was okay. But I noticed yesterday, which was interesting, it was 48 steps from ground floor to my office in Building 6 at Daktronics, and I got to the top of the stairs and said, wow, you know, I'm starting to walk in the middle of the stairs over at the gym, and I walked down those 48 steps without grabbing the handrail. First time that I can remember. So maybe it's mind over matter. You just say you can do it and keep practicing until you do it. But I've been active, played football, high school and college, and wrestled in college, and coached for 17 years. And now at work, up until recently, I would give a lot of tours and walk the stairs and work out. Now since my heart problem, I work out at the gym 3 times a week religiously, and so I think we have to stay active. Otherwise, it would probably progress a lot faster. I don't know because I'm active.
Thank you so much for that great story and being willing to be filmed and tell your story. We've got a bunch of questions, so I think we should just jump right in and start rolling through them. Quick answers, solid, important information. Discuss plantar fibroma treatment. I think she's thinking plantar fasciitis. What's the treatment for plantar fasciitis?
Fibroma is like Lederhosen's, and you know, she may be, you know, Dupuytren's contracture. It's a, yeah.
Okay,
similar.
so tell us what plantar fibroma is.
Well, it's usually a painful nodule on the arch of your foot, a solid, kind of freely mobile nodule on the plantar aspect of your foot. And you know, by the time they see me, sometimes we're operating on them and resecting those nodules. But you know, shoe modification. I think Dr. Peterson could talk more. But I know one of it's shoe wear. You know, offloading the, you know, for pain control.
Oh, and getting an arch support that has a pressure off that spot.
Right.
Comment?
Well, you know, I mean, there's a couple different conditions. There's plantar, you know, there's generalized thickening of the plantar fascia. There's, you know, what Jonathan was talking about. I think that what Jonathan was saying is great. I think that often stretching exercise can be helpful for chronic painful conditions of the sole of the foot. You know, but generally speaking, if this is plantar fibroma, it's you know, you kind of need to know how extensive it is.
If it's bad enough, it needs to be cut upon.
Or potentially have other additional types of treatments done. Yeah.
Plantar fasciitis, real quick, like, what is it?
Well, that is painful, is what that is.
Oh, I got it from trying to expand my running distances, and the bottom of my foot, right near the heel, it hurt so bad I had to dance to the bathroom whenever I'd get up in the night, you know, and that's it.
Have a vision.
Yes.
Well, one patient, I like what some people describe it as doctor, you know, my first step in the morning is painful. Of course, every other step is painful too. Yeah. You know, so there you go. And you know, plantar fasciitis, basically, there's a strap that kind of connects along the bottom of your foot.
Okay.
And it helps provide your arch.
So the strap stretches here across
basically.
and makes the arch. It's sort of like a bowstring.
Yeah, exactly. It kind of, you know, keeps you together as a foot. And so if that gets stretched out, as you can imagine, it can be a pretty painful thing. So what we like to have our patients do is gentle stretching exercises. Rolling the foot over a can be helpful. Achilles stretching exercises. So here I'm doing that same thing with that foot again that you did. But notice how gentle I am. Yeah. But you know, Achilles stretching exercises can be helpful for that as well.
Okay. Painful top of the feet, flat feet. What's the possible cause? John.
Gosh, that's why we're having the show, because feet hurt so much. You know, flat feet, it depends on if they're fixed, flexible, how long they've been there, were they there, you know, as a child. You know, foot pain too is a lot of times developmental, how you've been treating your feet, and then what you do from there. But that's a very, very kind of wide open question. You can modify shoe wear, do lots of the stretching, strengthening. That we're going to keep kind of probably going back to those things, I would say, with feet.
You know, I think one important comment about this is that if you have pain on the top of your feet with flat feet, I wouldn't assume that pain is from your flat foot.
Yeah,
it might be something else.
I would get that looked into, I think.
It's more often the bottom.
Yeah.
Do you think that people ever tie their shoes too tight, and a lot of the problem is, I mean, because you can, in the office, they'll just go crank, 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 and of course vascular compromise is part of it, and they tie their shoes too tight. I think it's important to be firm, but not too tight. No comment?
I think that's absolutely correct. I mean, you know, too much of a good thing, as we say.
And also, when you are 18, you may have a 11 foot. By 50, you likely will have a 12 or a 12 and a half. That's the other thing. Remeasure your feet as you get older, because they get bigger.
Yeah, no, absolutely. But if your feet are really getting a lot bigger, you know, you need to get that checked into also.
Right, you could have a growth hormone.
Because you can have an endocrine issue. So.
Driving cramps in the crown of the foot when driving. What are the causes of cramps in the feet and also a bad foot odor? Cramps in the feet.
Yeah, the foot odor is usually from, I know you said cramps, but to go to the foot odor, a lot of times it's the wicking properties and
too much sweat.
Yeah, a lot of times, and people sweat at different levels. So you know, somebody, and I've heard of people even using deodorant. Spray deodorants used to be more popular. They do affect your pores and your perspiration, but using deodorant on their feet. They use that in tennis for their hands so their rackets don't slip, and it's the same thing.
It might well be worth considering, as long as you don't don't have trouble with the
right.
with
Yeah,
the
it can have some. The
irritant.
fragrance can cause the irritants and stuff like that. But you know.
So the other question was the cramps. I would say the one thing about cramps is I think it's related to increasing your exercise, and stretching before you go to bed is probably the key.
Hydration.
Hydration.
Making sure vitamin levels are okay. If you're on some kind of medicine.
Some medicines can do it. Yep. Okay. I have a question from the in-office caller about corns. Any comments about corns?
Corns are almost like moles. I mean, it's part of almost the aging process, and there's times you saw Dr. Venner, and he's an excellent podiatrist. There's lots of podiatrists in town, and sometimes you do have to, if you're not careful, taking care of the corns yourself and shaving them and doing things like calluses on your own because you don't want to get into a layer of skin. But it may take a visit to a podiatrist to control them. But I think they're so common that
they are incredibly common. And you know, if you have any kind of sensation loss, it's really great to make sure that that's being trimmed by somebody who is not going to,
without a doubt,
right, not going to cause a problem.
A call from T, South Dakota, where Skeather shoes and what they think rocking shoe. What do you think about Skeather shoes and rocking shoes? Skeather shoes, do you know?
I think it's those rocker bottom shoes now that are for exercise, like MBTs or something.
Okay. You know, I guess people are using those for a variety of different indications. I think that, you know, different people's feet will tolerate that stress more or less well. We talked about the flat foot. The flat foot is a really flexible foot. On the other hand, if you have a really high arch and all of a sudden you're changing the angle, the shock absorption in your foot, you know, your foot might not tolerate that as well. So,
we've got an Achilles tendonitis. What is Achilles tendonitis, and what can you do about it?
Well, tendonitis is, in general is inflammation of a tendon. Anything with itis is inflammation, and it gets again back to stretching, exercising. Again, I'm more of a natural type person. I don't love the idea of anti-inflammatories.
But sometimes they may be
But
helpful.
sometimes, that's why I mention it, without a doubt, for an acute phase, not chronic.
Right.
Stretching is huge.
The Achilles tendon is that tendon going up from the heel up to the back of the calf. And that tendon, that major, strong, huge tendon, can get inflamed, no question.
It doesn't have great blood flow.
it is a common and really annoying issue for people. And I'm so glad that somebody asked about this, because I think it's so important to remember that when you're stretching the Achilles tendon, you really want to think about stretching that with your knee straight and your knee bent, because otherwise you're not really completely stretching.
So you stretch it with the knee bent, and you stretch it with the knee straight.
Correct, because then you're stretching different muscles, and then you're getting a much more complete stretch.
Okay.
And then the other thing that we should talk about is when you're stretching, ideally, if you have some kind of warm-up before you stretch, generally speaking, a stretch will be much more effective. And so if you could do maybe some light activity first so you get more blood flow to that area, you'll tend to have a better stretch.
I mean, there's a lot said about stretching before your exercise, and now the big thing is you don't stretch before your exercise. You get started, you warm up, and then you stretch. Is that what you're saying?
Right, exactly.
It's
stretch after you exercise too.
Yeah, right. Feet never still when sleeping. What are the causes?
Well,
The
you
restless-
probably know, you
the
probably
restless
see
leg.
this. I wouldn't see this as much, but RLS is huge.
Well, restless leg syndrome, it's who knows why. It may be a neurologic condition of some unknown type. We used to say, well, we treat it with the same drugs that you use for Parkinson's. And sometimes that can begat worsening of the syndrome, so you've got to be very careful about using those medicines, Cinemet or that kind of medication. I commonly will use one of the alternative drugs, Mirapex-like medicine, but occasionally you've got to realize that certain drugs will make it worse too. Antidepressants will make restless leg syndromes worse. So you've got to be careful about that. Iron deficiency or anemia will bring on restless leg. You've got to make sure you don't have iron deficiency.
Right. I was going to say, anybody who has restless legs really needs to go in and talk to their doctor and get a basic metabolic workup.
Yeah, it's a challenging issue. We've got the orthopedist stumped. He's got a frown on his face.
Yeah, I'm learning something about RLS. I know Requip's out there, but you know more about the medical treatment. I was going to ask Dr. Peterson. I don't know. You know, you're excellent at having other therapies, and I think that's a reason why I send patients your way, because it's not just medication. Is there any type of specific exercise or any tricks you've learned with RLS, or that you've you know?
Well, our patients who have RLS, I think one thing that does tend to help is stretching. Okay. I think that part of it is, we tell people, just like you tell people, listen, you have to get screened for iron deficiency anemias, et cetera. And also RLS, somebody needs to take a look at you to make sure there's not an underlying neuropathy. Because a lot of times you can treat the neuropathy and then the RLS symptoms will be lessened.
And the classic causes of neuropathy, peripheral neuropathies that causes numbness besides diabetes, is thyroid disease and B12 deficiency. And you got to catch those. I mean, if you B12 in particular, because people can get demented from B12 deficiency. Right. You catch it early, you can save them from dementia.
Right.
I wanted to say, though, that's different. RLS is different than leg cramps at night. People will wake up in the middle of the night with these horrendous calf leg cramps. Right. And you just have to immediately stretch that, and it'll solve the problem. If you let it live for a while, it'll destroy some muscle, and you'll have to live with that pain for days. Here's a question: numb toes, neuropathy. What can I do? We just did that question. Hearing, heel spur, and wondering about how to treat it. How long does it last? Now that was addressed by our. It is not the problem, right? You don't cut it out.
Boy, and that's a tough one with patients too, because they'll look at an x-ray and by golly, that spur is the problem. Interesting with plantar fasciitis, about 50% of the time in the large studies there's a spur. So the other 50% there's not a spur, and it's almost like a mama taking a child to you that has a cold and you saying this is viral, they don't need antibiotics because they think, I need antibiotics. Right. And it's the spur is the problem. And that's a great question. You have to be very careful. I would caution this patient if it was mine. From the surgical side, lots of non-surgical treatment, and that's always the primarily. If somebody said to have surgery on that, boy, I really, really would think twice and exhaust conservative care and get second opinions before you have that heel spur resected, because I can't tell you the amount of people I've seen in second opinion that said, I had this surgery, it didn't help at all, and you're like, ugh, you shouldn't have never done it.
And if you have a heel spur, I would take that as a message that you should be stretching more.
Yeah,
that's
yeah,
it.
I would think about that, before you, that's usually the first thing we tell people when they come in and they show us these spurs. Say, well, there's a good reason to talk about stretching.
Yeah, it's a reaction to the problem, not the problem.
Not the primary. Yeah.
That's right.
That's right. It is a challenging conundrum or problem that most of us foolishly ignore our feet until they give us trouble. This last week, a woman in her 90s hobbled into my office complaining of an exceedingly sore foot. There was a hard, pointed callus on the sole of her foot where the fat pad had thinned with age and the bone was very prominent. This had progressed to the point where the pain was keeping her from being able to do the activities of daily living, and a blood blister was starting to form under the callus. It was like walking with a large and sharp pebble in her shoe. I have seen similar foot calluses form a blood blister, get infected, and eventually result in foot amputation. After positioning her on the examining table with a very sharp scalpel, I gently and carefully shaved layer after layer of thickened skin until the callus was gone. That accomplished, we provided for a molded foot insert that took the pressure off the bony prominence in order to help prevent reoccurrence of the callus. She left the office happy with the pebble gone. Apparently, by definition, there is a difference between a callus and a corn. Calluses are the natural and protective thickening of skin on the palms of the hand and the soles of the feet, the knees, or anywhere there is prolonged and increased pressure or friction. Corns are by definition smaller, form on the top or side of a toe, have a harder center, and are surrounded by inflammation. And for what it's worth, it's rumored that the corn was named after the famous ancient Roman scientist and medical writer Aulus Cornelius Celsus. Most of the time, calluses and corns can be prevented by wearing properly fitted shoes and grinding down excessive buildup of skin with sandpaper or pumice stone, or even with fingernails during a shower or a bath. Commonly, this challenging problem occurs because many feet and toes are quite deformed and cannot fit into shoes without resulting in calluses or corns. Sometimes the only solution for such a misshapen and distorted foot is surgical correction from our good orthopedic friends. Corns and calluses seem like uninteresting and insignificant medical trivia until pain begins or amputation threatens. Don't ignore your feet. Comments on that particular discussion of corns and calluses?
Well, I think that that's a really excellent point. I think that, you have to deal with it. And if this had been dealt with sooner, this person could have had better walking and, better exercise, less pain. Sad to hear about the pain.
Well, and and she almost had an ulcer and almost had an infection. Yeah. But I have another patient who said, should I get my deformed toe fixed? She's got this big hammer toe that's hanging out there, and there's all sorts of irritation and inflammation, and it's uncomfortable for her, and I'm telling her yes. What do you think, John?
Well, I think that there's two reasons, and it's very important, and I respect the cosmetic side, but you have to look, number one, at pain. I think that has to be the driving force for most people, but you can have the discussion, or I'll see a patient that says, it doesn't hurt much, but I just simply don't like the cosmesis of it, and then you have the standard discussion. I don't disagree with you. If it's rather dramatic, it affects certain, and it's a common, easy fix usually. I say that tongue in cheek because there is risk with even hammer toe surgery, and you have to be specific with patients before even a minor surgery, what I would consider minor versus like a hip or a knee replacement.
Well, oftentimes these are older people whose blood flow is compromised. When there's bad blood flow,
sure. Yeah.
Their
workup that changes it. If somebody's maybe a smoker, if they got bad uncontrolled diabetes, then I would say absolutely not. So that's why there's a workup and an evaluation. But otherwise, healthy adult female that has a hammer toe that's rather dramatic,
I'll throw in a word on the vascular people. That when we have a problem in that foot and there's bad flow, then it's time to get to the vascular people and get they can do stents and they can improve the blood flow, and then you can do surgery. Well, take-home messages. We've got less than a minute. Judith.
I think the take-home message is that if you have pain with walking, if you're having numbness in your feet, if you have your legs jumping around at night, get it checked out. Go talk to your doctor and get advice on how to help it.
Jonathan, one word?
Don't ignore your problem. Get some help.
Well, I so much appreciate both of you for joining us and sharing with your medical knowledge tonight. That closes our show on feet. I sincerely thank our studio guests, Dr. Judith Peterson of Sodak Rehabilitation Center in Sioux Falls and Dr. Jonathan Blake of the VA Hospital in Sioux Falls for helping answer all of the wonderful questions from our audience. And with that, we'd say, be careful. And, Ralph Waldo Emerson said, "The civilized man has built a coach, but has lost the use of his feet." Until next time, stay healthy out there, people.
provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.